Younger people in the Ashanti region capital, Kumasi, are getting infected with COVID-19. That's the latest information according to health experts in the region. Dr. John Amoisi of the Kumasi Center for Collaborative Research, who reviewed this, said the numbers are higher, particularly in the Ashanti region. He's warning the country will be badly exposed if the new variant is detected in the general population. He wants the Ghana Health Service to strictly enforce testing and quarantine of those that test positive.
I really want to make it clear that the manifestation of the third wave is very critical. In the UK, one could argue that they are actually in another wave of sorts, albeit maybe a fourth wave. But what's happening is that it's not going to impact on the hospitalization rates and the death rates. It's the infection rates. So what does it mean for us here if we are in a third wave? For me, it means that the risk of severe disease and ultimately hospitalization and death might be high. If you look at the numbers in the Ashanti region, it's already going up. We're doing some work, right, for which we need to do some pre-screening. And I can tell you that over the past 2 weeks, we've seen a significant rise in the numbers of positives that we're seeing. We did a pre-screening and half of those we pre-screened were positive. All right. It's really interesting. And I actually told my team that just wait till next week. And it's exactly happening as I had predicted, because, you know, the science doesn't lie. It's just like, you know, it's just what it is. It will happen. All right. And it is happening. So what this means is we need to be really careful. And if you watch carefully, it's exactly the same picture. It's the younger population. It's the younger population. Because of where I sit, I get many calls from people. Oh, I'm not feeling too well, so and so and so. So you send them for testing, you find that it's positive. And then you just have to make sure that they're isolated and so on. So
that's Dr. Amoisi there speaking last night with my colleague Evans Mensah, revealing the statistics in Kumasi, in the Ashanti region. And that's where I'm taking you right now. We've got Dr. Michael Rockson, AJ. He's a Deputy Ashanti Regional Health Director. Doc, thank you very much for your time. I understand you have a very busy schedule, but let's try and get a bit of an understanding. Has this new information about the rising numbers in your region come to your attention? I believe it has.
And thank you for having me. Yes, there is something we are fully aware of from the week 23 of this year. That is last 3 weeks up to date. We are fully aware of what is happening with respect to the number of cases we are seeing per week.
So the number of cases you're seeing per week, I suppose, is rising. Can you share with us a bit more of the statistics? What do the numbers look like?
Okay, let me take you a little bit back for us to understand the trend. After Christmas, that's when we started this year, the average number of cases we were seeing per week was around 300, 350. And then at the end of February, beginning of March to the middle of March, we started seeing a decreasing trend, that the case suddenly fell to 20 per week. And that had been the trend for the last 3 weeks, when we started seeing an average of 35 cases per week. So obviously we are having almost doubling of the trend we've observed for the past 8 weeks or so.
It actually looks much more like than doubling, because if we had 350, if I got you right, is that 350 per week?
Yes, that is with regards to January to February, and then we came to 20 per week.
Yeah.
So this doubling is with reference to the baseline, the new baseline we set after coming down from 350 to 20, had been 20 for about 8 weeks before the last 3 weeks. That's what I'm saying. Okay. It is doubling.
Okay. So from the 20 per week, which was at the time that the numbers were going down, we are where at this moment?
Now we are doing 35 cases per week averagely. Okay. And if I have to go into the detail, when this spike started, that's last 3 weeks, we recorded 39 cases. And then last 2 weeks, we had 37. And then last week, we had 43. So if you strike the average, we are almost around the figure I'm talking about.
Right. And this should certainly be a sort of concern to you. Do you know what is accounting for this?
Obviously, we are very much concerned because when we came to a new baseline, so to speak, of 20 cases per week, yes, we were very happy because people were adhering to protocols. We were all together as one. But prior to this surge, we saw certain change in regards to people's attitude towards the protocol. We were not regarding, we disregarded nose mask usage. And for example, we did a casual survey at KJTR, Edum area, and we found less than 3 people per 10 wearing face mask correctly. Okay. So we knew that this event will come up one day, and we intensify education. But you know, there's a difference between educating the people and they adhering to it. So that has accounted for where we are now.
We are glad to hear from the health service, Ghana Health Service, that although we have recorded the Indian strain, it hasn't gotten to the community yet. But then we've been speaking to some of the people in your region. Doc, if you just give me a few minutes, we'll just hear them and then we come and wrap up with you. I understand you have to go for a meeting, but let's hear what people in Kumasi think about this new development.
There's nothing I'm doing about the safety protocols. Me, for instance, the way the media were preaching about this coronavirus pandemic, nowadays I've not been hearing it. So me, I think it is gone for good, and there's no way to come back. I heard the Ashanti region, we are leading. When you see our attitude, the attitude of the people in the Ashanti region is very bad. Though it is not gone it is not gone. But the way, especially when you sit in the trotro and the taxi, people are not wearing their nose masks.
The Ashanti region, we are having a problem because of the political interference of the district. Because recently, when the St. John burial, and a lot of people are making a lot of comments that if the president will be making all the necessary about to wear the face mask and all this, and then they themselves, during the funeral, there's a lot of things happen there. And then because of that, a lot of people, then you can't be communicate to some people who are not wearing it. Because when you try to let them to use what you are doing, they are trying to refer you to the politician.
Coronavirus, I said, in said that you say coronavirus be because here abrofun on the coronavirus started free by you. The you see our mobile when you pay good stadium ye na here to Ghana the coronavirus be conclude. I mean they say in penny phone discadi oh abrofun hono sala mi hunu pa because here this schedule we are not adhering to the protocols because we are tired of them. Every day there's new virus. Every day there's new virus. We don't know what to do again. We are tired of them. They should come and kill all of us. We are tired of them.
And that's the typical behavior that you find on the streets. I mean, not just in Kumasi. You find this here in Accra. You find this. I've been to the to Bolga about last 2 months. You hardly find people wearing the mask. You are concerned, but you said that the health authorities in the region have been sensitizing the people. It looks like it hasn't really worked, has it?
Yes, you can say that because if it had, you would find a lot of them adhering to the protocol, but that does not actually break our effort or make us feel unrewarded. We are still up because that is one of the ways to ensure. Let me add that the protocols are the first line in preventing infection. So for me, I'll go much of the protocol than even talk of the vaccine. The vaccine is a second line, and we know the global strategy. So the only arsenal we have in our hand to beat COVID-19 is observing the protocols, and that is very cheap to do. Everybody knows what to do. So if we do that, we prevent exposure in the first place, and also prevent people from getting infected. no matter the type of strain that comes up, the protocols can stand the test of time. For mutation of the virus, the Delta variant is not going to be the last. We're going to have several of them because that's typical of viruses. They keep on changing and they get more lethal and lethal as they mutate. But like I said, the protocol will surely stand. So we are not relenting. And we'll go on to do what we have to do as public health physicians. And we also implore the security agencies to also enforce, or government to enforce the laws on these protocols. And I believe that when enforcement is done together, we can bring down this spike that we are seeing.
Interesting. Let me just wrap up by asking you, the Ghana Health Service says we don't have, the new variant traveling to the communities yet. As far as we're concerned, it looks like it was detected at the airport and has remained at the airport. Should we, just in case, have this in our communities, to what extent do you think the Ashanti region is ready infrastructure-wise, personnel-wise, to deal with an outbreak again?
We've never gone out of the pandemic. We've always been in it. So we've not let down our guards. Our systems are well in place. So we've never for once thought that, it's over, so let's pack our tent and move. We are always ready to deal with the aftermath of any variant that may enter our communities. But let me also emphasize again, we have to adhere to the protocols. I heard the young people, the young men, or the people you interviewed, talking about being tired and so on and so forth. I share their concern, but we're able to take out this pandemic. We can't get tired. If you get tired, it means that you want to die.
I like the way you end it. I think that should be okay to leave the conversation here. If you want to die, then you don't observe the protocols. Doc, thank you so much for taking time off your busy schedule this afternoon. Dr. Michael Ajay is Deputy Ashanti Regional Health Director there. And we went to Kumasi because we're hearing there that many more young people are getting infected. And the numbers are going up, by the way. Well, over 90% of the population have yet to even get the first dose of the vaccination. And this, the Food and Drugs Authority finds worrying. Chief of the authority's Joint Committee on Vaccine Safety, Professor John Japon, says a third wave may not be good for the country. He spoke earlier on the AM show.
We need to alert our public health system to ensure that that the protocols are maintained. Because it is the same thing, whether it is Delta, Gamma, Beta, or Alpha. It is nothing else that we can do except to ensure that the protocols are enforced. Okay. And I want to emphasize this because even in a country where less than 2% of our population have been vaccinated, that is our best bet. In fact, that is our only bet that we have. In the UK and other places where they have vaccinated a much, much bigger percentage of their population, the force of infection is much lower. And even that place, they are having challenges with the Delta strain. So can you imagine what would happen if the Delta strain were to get into our community and begin to spread? It will spread like wildfire. So we need to, reinforce our surveillance system, particularly at the airport, and then also at the community level, to ensure that if there are any cases that have come into the community, we use our surveillance system to identify and put in place the appropriate public health measures to avert any wild spread.